I'm Dr. Roux Martinez. I am the medical officer here in the burns unit, and I have been here for the last 15 years. Last week we had a little 5-year-old girl who sustained very bad burns in a small village in the Eastern Cape. They drove for 14 hours to Cape Town because their mother heard that there was a burns unit here. And she arrived here in our emergency unit on the door of death. In fact, we actually don't understand how she made it. We had to stabilize her, get potassium back into her, take her to theatre. We had to graft her with some skin bank grafts, skin first, because she was just too unstable to have her own grafts at that point. And a week later, she was grafted in her own skin, and she is running around, and she's gone home, and she's just the joy of life. And we had a big celebration, celebrating her survival with a big cake for her. And that's the kind of miracle we will see over and over and over a year. And it's also the kind of miracle you never grow tired of. C2 is definitely the most special ward in the hospital. And I think the reason for that is because we walk a long journey with these patients. They're not like an appendix that comes in for 2 days and off you go back to your life. The life map of these children, most of them have really been dramatically changed in that one moment of the accident. And you start walking that whole long, rather hard road with them, but it's full of hardship, and it's also full of triumph, and that's the beauty of it. Yes, first of all, to every person, it's not your fault. I think that's the first thing you need to know. It is not your fault, because if it was your fault, there wouldn't be over 1,000 of these children just in one hospital of our country. So it's not your fault. Accidents happen. The second thing, your child is going to be okay. The vast majority are okay. And we will very quickly tell you if we think something is not okay. So your child is going to be okay. The third thing I think that's important is you need to look after yourself, because you are your best medicine for your child. We've got no drip or dressing or surgical procedure that's better than the parent at the bedside. That is really what sustains that child and what pulls them through. That is their reason to live.